Well, I would tell you, it's probably been 10 years since Hendricks Regional Health has wanted to expand its presence in Brownsburg. It just wasn't until about 4 years ago that we really decided that now was the time to do that. We wanted to expand, of course, keep our southern presence. We're going to keep that building in place, but we needed a larger presence in Brownsburg on the northern end. We knew that I-74 and Ronald Reagan were going to be a really key interchange in the future, and we wanted to be at the beginning of that.
Well, it came about through, I would say, very traditional business techniques or practices. As we learned, or confirmed, I think more, that there was a high demand for Hendricks Regional Health in Brownsburg, but we didn't have that many patients who could get all the way to Danville. So we had a situation where people liked us, people wanted to receive care from us, but there wasn't an access point. From that point, it really became a project to try to predict healthcare delivery in the future. We pride ourselves in thinking ahead, trying to match up the delivery model with what our patients, what society wants from healthcare. I believe that we're moving towards a more retail healthcare delivery model. And as we started to put pen to paper to design this, that was a very interesting concept. It's pretty easy at 30,000 feet to say we're going to be a retail healthcare delivery system. It's another thing to put that together.
This is enormous for Hendricks Regional Health. This will be our second hospital, and I think it's to be able to deliver these services to the Brownsburg residents in this fashion, greater access to high quality care, greater access to lower cost care, and a better patient experience. We couldn't be happier about this.
Well, I think the first and most exciting for us is we have a side-by-side urgent care and emergency room. If you follow along in healthcare, one of the greatest costs and one of the most unnecessary expenses is the inappropriate utilization of an emergency room. When you're really sick, the best place for you to be is an emergency room. When you have cold or flu, or maybe you just need a couple stitches, or you're not sure if you sprained or broke your arm, urgent care is a far more cost-effective and better model. So the first thing you're going to notice is our open spaces. We tried to use glass where we could instead of walls, give people a feeling that it's open, it's expansive, views of the outdoors. To know me is to know I love the outdoors. I believe there's a strong therapeutic component to being outdoors, seeing outdoors, experiencing it. So you'll see that almost immediately as you walk in. If you move to your right, you're going to go past our lab, the admitting area for if you need CT or MRI procedures. Further down the road or to the right, you're going to have physical therapy and occupational therapy. Again, really unique space, tall ceilings, floor to ceiling glass, looks out over the woods. It's a space where if you're having to do cardiac rehab or physical therapy or whatever the need is, it's the environment to get better. If you were to come in and go to our left, you'd immediately have urgent care, and further to the left would be walk-in for the emergency room. If you went through the doors of the emergency room, you'd see an emergency room beds that were uniquely designed by our team. If you move upstairs, you're in a rotunda type area. Again, it's glass, transparent. You can see from one space to the next. Then behind that is our inpatient unit. Single beds, single rooms. The rooms are designed so that when the bed's at an angle, you're looking outdoors, you can see the outdoors. The space is designed to be as home-like as possible. So while you're here and nobody wants to be in the hospital, it's an environment that replicates home as closely as you can in this setting.
Hendricks Regional Health is really known for a lot of things, but three things mainly. One is our patient experience. Patients are extremely satisfied when they leave Hendricks Regional Health. We have an award from Health Grades, which is a national organization that looks at hospitals all over the country. And we're one of the only 15 hospitals in the country that have won a 5-star rating on Health Grades for 10 consecutive years. And so 1 of 15 in the country, so that's pretty strong.
Hendricks is a unique culture. We are very much a family. And I think that shows up in a lot of different ways. I was pulling on the property last night, and I saw 2 different associates with their families, and they brought them here to show them this building. I think that speaks volumes for how excited people are that it's not just a place that they're going to work, but it's a place that they feel invested in and passionate about enough to, hey kids, we're getting in the car and we're going to go see where mom works. That doesn't happen everywhere.